Shio, welcome to Cherokee Now. Today we have Tracy Wolfe Birchfield joining the show. Welcome to the show, Tracy.
Thanks.
All right, so let's talk about your work with Cherokee Now Hospital, and in particular hepatitis C. Tell me a little bit about your background, first of all.
Well, I'm from Cherokee. Actually, my mom and dad were born and raised here. My mom's from Yellow Hill. My dad is from Birdtown. I got my education, my bachelor's degree of nursing at Western Carolina, and then I moved with Indian Health Service out to Chinle and stayed with Indian Health Service for about 28 years.
Oh, my goodness.
Actually was a commissioned officer with the U.S. Public Health Service. During that time period, I got my master's while I was living in Kansas at KU. I am a Jayhawk. Sorry, guys.
We won't hold that against you.
Sorry, guys. My daughter was born in Lawrence, Kansas, so she's a Jayhawk, but living here. My master's was from there, and then from there I came home about 1997, I believe, is when I came home.
Okay.
So I've been here ever since.
So what inspires you to want to help people? Where'd that come from?
That's a funny story. I was kind of floating around trying to figure out what I wanted to do with my life when I was about 20 and living in Phoenix on my own, and my parents were living in Reno, Nevada. My mother called me one day and said, "Why don't you come home and go to nursing school?" And I said, "Sure." So I did. And I've been in it ever since.
Okay.
So, and I like it. I've really liked nursing and doing what I do, and now as a nurse practitioner for almost 20 years, it's a little bit different. It's a little bit more mental tasking, but I've gotten some good feedback from some people, and I've got other feedback who people don't leave.
Oh, good. Well, the reason you're here today is to talk about hepatitis C. Recently, you had done, I guess, a presentation with the Res Hope Recovery Group. Tell me how that was received, how that went over.
That went over very well. The presentation I gave was about hepatitis itself and how it's impacted our community and how you get it, how it can be treated. And the people there were a varied group, some that had been through treatment, some that hadn't been through treatment. All of them were in recovery. One lady there that was actually a mother of a recovering person as well too. So she had a lot of questions, and so it turned out very well. I enjoyed talking to them, and they asked, why aren't you out in the community spreading the word? And I only go when people ask me. I don't just pop in on people and say, "Here I am, I'm going to tell you something." I wait for them to ask me. It's just I guess a Southern and a Cherokee thing to just kind of wait till you're asked to present something.
All right. Well, we're here today to talk a little bit about it. So let's lead into what is hepatitis C.
Hepatitis C is an infection of the liver. It is a particular hepatitis. There's several hepatitis infections out there that affect the liver. Hepatitis A, which you can get from contaminated food. Hepatitis B is more infectious, and that's the vaccine that is available out there for children and adults to prevent that one as well. Hepatitis C has been around for a while. It used to be called something along non-A, non-B because they didn't know really what it was or what it did. And then there's another one you don't see very often, which is hepatitis D. But hepatitis C is one that doesn't cause a whole lot of damage to the liver for about 10, 20, 30 years down the road. Sometimes you can get acutely ill with it, with flu-like symptoms, maybe a fever, a little bit of jaundice, and then those symptoms go away. And then other people don't have any symptoms at all. Okay. So that's the unusual thing with this one, is that people can have it not even know it, not realize that they have it. So
is there a simple test for this?
Yes, it's a simple blood test that can be done, and we do it in-house. And then a follow-up test is to see if you have been infected with it and cleared it, or you're still infected with it, and what the viral load is. And the viral load is not related to how sick you are. It just tells us how active it is in your body.
Why is it important for someone that may potentially have hepatitis C to get the test and know?
For a couple of reasons. Well, actually more. One, to prevent any complications down the road. This can cause liver cancer. And this is why the Center for Disease Control has put out the word that baby boomers, those born between 1945 and 1965, be tested. A lot of these people were coming into their doctor's offices with advanced liver disease or liver complications, and this is how this was discovered. It was predominant in this age group. The other age group is the not really millennials, but the 20, 30, 40-year-olds as well too. And mainly that's from injecting drugs or snorting drugs as well too. And the third group, my brain has totally
You've got so many numbers running through your mind about
this. A lot of
this.
information. But it's a simple blood test. If you don't know if you may have it, just like HIV, we say, come on and get tested at least once.
Okay.
If you don't have it, you're fine. If you do have it, then there's something we can do about it.
Okay, well, having said that, how does it transmit? How do people
Transmission
get it?
is usually through blood. So that, as I tell my patients, if it bleeds, that's how you can transmit it. So through the veins, injecting blood, injecting through the veins, snorting through the nose, not smoking so much, sexually transmitted, very rare. The same transmission from mother baby is the same as if you were to have sex. So it's about 3 to 5%.
Okay.
So any of our moms who have hepatitis C and haven't been treated yet, we follow those children after they're born as well too. So those are the main routes of transmission.
Okay. What is the Cherokee Indian Hospital Authority doing to help treat the disease?
Well, all of our primary care providers have been trained to offer their blood tests, follow up with the blood test, and then they have nurse case managers who will ask some additional questions as well to get medication to them. So the medication is provided to the patients through the drug companies, as far as I know. But the providers are there to answer your questions and let you know what it means to be treated, let you know what it means for follow-up, how to do prevention and not get this again, offer you other assistance if you have any type of addiction problem or just concerned about the other members of your family. We're there to educate you as to what this is and how to prevent it and what you do afterwards.
Absolutely. Okay. What are some common misconceptions about hepatitis C? I know there's a lot of tabooness with the issue. We mentioned earlier about HIV and other kind of viruses are transmitted this way. What are some misconceptions?
The biggest one I saw, especially in my younger people, is, am I going to die from this? So that seems to be the big thing is, am I going to die? And it's like, no, you're not going to die from this.
Okay.
Not immediately. And we don't know who's going to progress on to any advanced disease if they don't get treated as well too. So that seems to be the biggest one. The other one I think is just fear, fear in itself. People forget that we also have HIV out there, and it's like, well, if I get tested for this, or they're going to test me for that, and then people are going to know I have it. Doesn't mean that you can't continue to work or do whatever you're doing. You just have to be careful. If you're bleeding, control your own bleeding. Let people know. Let me clean it up if it's not too serious. That type of thing. Bag it up and then throw it away in the trash in its own things, just like anybody else who's bleeding as well too. So that the biggest one is I think was just, am I going to die from this? And no, you're not going to die from this.
But it certainly needs to be addressed.
Certainly needs to be addressed. Number one, to make sure that you're healthy, make sure that the liver is healthy and can handle the treatment as well too. For the moms out there, it is to make sure that you don't pass it on to your children. For the dads, it's the same thing, bleeding, I'm not going to do all of this. We tell people, don't share razors, don't share toothbrushes in that sense, because again, you don't know how much a minuscule drop of blood can transmit that as well too.
Stuff we can't even see.
Right.
Okay. Where can folks go to get more information or have any questions that they have about it answered?
There are two places that I know of, and there may be even more. One is the needle exchange program that we have available here on the reservation. They have a lot of information about hepatitis C and other diseases, how you can get tested for it, and that type of thing. The second place is obviously if you know who your primary care provider is, to make contact with them. You can go when you walk into the hospital to the patient registration desk that's right there in front and ask them who is my primary care provider, and they can look it up for you, and then they can call the nurse out, and you can have a short discussion with the nurse about, what needs to be done, and then they can try to get you an appointment later on and maybe go ahead and initiate the blood work for you if you want to be tested that day, and then come back and discuss those results.
Excellent. Okay, is there anything else you'd like to add to it, Tracy?
No, I just want people to realize that this is not something that is an immediate I'm going to die type thing, but it is so vast. There are 2 to 4 million people out there in the United States with hepatitis C and don't realize they have it.
Wow.
So, and in this population, the amount of people that have been tested is pretty outstanding as well, too.
Okay.
So we'd like to get as many of those people treated as quickly as possible so that we don't transmit this on and it's not spread anymore. And it's also preventable. So if we could take a community stand. If you can be healthy and community stand and don't make judgment, and we're here to help.
Absolutely.
We're
and I think
help.
it's key what you just said. Like let's as a community, let's take a stand to kind of eradicate it out of here. Mm-hmm. Let's get tested. There's no shame in it. Let's just move on and
we're asking everybody, no matter what their age, would you like to be tested for any of the diseases out there that we can test for?
Right.
So and that includes HIV, hepatitis, your blood sugar. So, the earlier
I need that one.
But the earlier that we can catch it, the better off you're going to be. So,
Well, thanks for all your work in this, and hopefully we're making this a healthier place for everybody, and continue to put the word out there and help folks get educated about hepatitis C and other things.
Okay. Thank you for having me.
Well, that'll be it for today. If you're listening at home and would like to comment on the show or ask questions regarding what we've discussed today, please comment on our EBCI Cherokee Now Facebook page at facebook.com/Cherokee Now. We'll see you again soon. Data Dog.